Hello, I'm Peter Zelas, Chair of CHASM. I'm delighted to be introducing you to the online reporting system for the audit of surgical mortality. As fellows, you'll be aware that the CHASM team within the Clinical Excellence Commission, together with the College, have been developing a new online system for the reporting of surgical deaths, which will provide greater efficiency, accuracy, and security. Surgeons can now also produce their continuing professional development reports from the system. The new online system is called the Binational Audit System, or BAS. Surgeons can log in via the Fellows interface on any mobile device or PC with an internet connection. From the 1st of July 2018, surgeons can submit their surgical case forms and first-line assessments electronically at anzasm.surgeons.org. While the electronic format is encouraged, CHASM will accept paper forms until the current system is phased out in mid-2019. The following video will demonstrate how you can use the system. An online user guide has also been sent to you via email. Both show the ease and convenience of online submission. CHASM staff will be available during business hours to answer any questions and provide support. I encourage fellows to try out the system and experience the benefits for themselves.
Hello, my name is Kim Oates. I'm a paediatrician, not a surgeon, but I hope that won't put you off. This video demonstrates how you can electronically submit case forms and first-line assessments. It's a step-by-step instruction guide to demonstrate how this new online submission can be easy and convenient. It's being launched by the Clinical Excellence Commission and by the College of Surgeons. We think it will provide greater efficiency, accuracy and security in reporting deaths under the care of a surgeon to CHASM. It can also earn you CPD points. It's compatible with most mobile phones, tablets, laptops and desktop devices, so it's possible to report to CHASM from anywhere as long as you have an internet connection. CHASM will still accept paper forms until the current system is phased out in mid-2019. Second-line assessments will continue to be paper-based due to the high volume of medical notes required to complete a review. If you have any questions, you can contact the Clinical Excellence Commission at cec-chasm@health.nsw.gov.au, or you can telephone on 02 9269 5530. That's 02 9269 5530. There are three ways that you can log in to the Fellows interface. The first way is you can just go directly to the website on this screen. Then enter your username and the password provided by CHASM in the ANZASM credentials section. The second way is you can click the Login with RACS Credentials button and use your RACS username, which is your email, and the password provided by the college. And the third way is you can just click on the link in the email you were sent by CHASM notifying you of a new surgical case form or first-line assessment for completion. If you don't have a username and password, or if you can't remember the details, and that certainly happens to us all from time to time, you can contact CHASM by selecting the Help link on the login page, and you'll then be issued with your login details. And if you've forgotten your password, select the Reset Password link, and your password will be reset and sent to you by email. When you've logged on, the Assigned Cases and Assessments page will show these headings: Self-Notify, Surgical Cases, Delegated Cases, Assessments, Reports, History, and Account. Remember, if you need help or if you have a query, the CHASM office staff are available between 9 and 5 on 02 9269 5530. But if you need help or have a query out of office hours, just select the Contact and Support tab to send an email, which will be answered the next working day. We welcome your suggestions and feedback at any time using the Contact and Support tab. This Fellows interface has been enhanced to enable users to generate a notification of death. From this notification of death, the interface will create a new case with a unique study ID and enable you to complete and submit the surgical case online. Once a case has been created, it can also be delegated. Instructions on how to delegate are given later in this presentation. To generate a notice of death via the Fellows interface, simply log in using your username and password and then click Self-Notify. It's important to complete all the fields. If you try to save the notification without populating all the mandatory fields, a warning will be generated with all of the incomplete fields highlighted. To see which mandatory fields still have to be completed, just click Validate. Once you have populated all the mandatory fields, select the Save button. At this point, the interface will create a new case with a unique study ID, and it will prompt you to click on Delegate this surgical case or Complete the surgical case form. And you can now complete the surgical case form, or you can choose Save for later submission. Just a reminder, if you try to submit a surgical case form without populating all the fields, a warning is generated highlighting all the incomplete fields. If you're not able to complete the surgical case form in one sitting, you can select Save and Close, as long as the mandatory fields have been completed. The case will then appear on your interface summary page. Once you have populated all the fields, the green Submit button will become enabled and the surgical case form is now ready for submission to CHASM. If you want to view or complete a surgical case form from this Assigned Cases and Assessments page, simply click on the case you want to view or edit. To reject a surgical case form, for example if the assigned patient wasn't yours, click on the menu icon, that's those three vertical dots on the screen, for the case you want to reject. Then select Reject, and you have to state your reasons for why you are rejecting the case. To submit a surgical case form, complete the form, including a review of any incomplete fields. The response to question 9, that's the question about the course to death, should include a summary such that an independent surgeon would be able to clearly and accurately follow the course of events. If insufficient details are provided, it may be necessary to request further information. If this is the case, a surgical case form will be returned to you via the Fellows interface, and you'll receive an email advising you of this. Then select the Submit button. To save the surgical case form for submission at a later time, select the Save tab. Note, a helpful prompt will appear at the bottom of the screen confirming that all data already entered has been saved. To save and close, select the Save tab, then select Save and Close. To view a history of all your submitted surgical case forms, you can select the History tab. Then click on the case you want to view. Note, the submitted surgical case forms can be viewed, but they can't be edited. A new feature of this interface enables you to delegate your surgical case forms for completion. Forms may now be delegated to a fellow, a SET trainee, or a registrar. To do this, please click on the menu item, those three vertical dots, for the case that you want to delegate in the Pending Surgical Case Forms field. Then select Delegate. This will generate a dialog box titled Terms and Conditions. Please read through and accept the terms and conditions. You will then need to enter the email address of the person you wish to delegate this case to. Although you can delegate to a junior colleague, you can't delegate a case to another consultant. This means that if you believe a case has been incorrectly assigned to you, you'll need to reject the case, stating your reasons for rejecting it. CHASM will then reassign the case to the appropriate consultant. If your delegate is already registered with CHASM, they will then receive an email prompting them to complete the surgical case form. If your delegate has not previously registered with CHASM, you will be asked to confirm your delegate's email address by entering twice to ensure that it goes to the correct person. When the delegate returns the surgical case form to you, the status will change to green, Delegate Case Complete. Then click the case to open it and review the surgical case form details, noting that you can edit any of the fields. If you're happy with the details of the case, click the Submit button. You will then be prompted to agree that the content is accurate before you can submit the case to CHASM. Delegated cases may appear as pending, meaning the case has been delegated and is awaiting completion, or as incomplete, meaning your delegate has started to complete a case but hasn't yet submitted it for your approval, or complete, meaning the case has been completed by your delegate and it's now awaiting for your approval before being submitted to CHASM. If you change your mind about the delegation, you can recall the case by clicking the menu icon, that's those three vertical dots again, and clicking the Recall button. Recalled cases can then be reassigned to a different delegate through the same process. Once your delegate has completed the surgical case form, it will be returned to you online. You will need to review it prior to submission to CHASM. When you have been allocated a case for assessment, a first-line assessment notification email will be sent to you. This email will contain a link to the Fellows interface. Please then follow the login instructions and navigate to the Assessments tab. If you want to view or edit a first-line assessment, on the Assessments tab, click on the case you want to view or to edit. Please note that first-line assessments can't be delegated to a third party for completion. To reject a first-line assessment, click on that menu icon button for the case you want to reject. Then select the Actions tab and then select Reject. You'll need to state your reasons for rejecting the assessment. To submit a first-line assessment, complete the form, including a review of any incomplete forms, and select the Submit button. To save your first-line assessment, for example, if you want to submit it at a later date, select the Save button. A reassuring prompt will appear at the bottom of the screen, and that confirms that all the data already entered has been saved. To save and close, select the Save tab, and then select Save and Close. The format of the screen shows the surgical case form on the left-hand side of the screen. The first-line assessment appears on the right-hand side of the screen in green. If the case involves more than one surgeon, a drop-down menu will appear for ease of switching between surgical case forms. This gives the opportunity to review each operative surgeon's input. The Account tab allows you to update your preferred email address together with your level of participation. Your default email will be the email address provided by the college. You can view your audit activities, such as how many surgical case forms and first-line assessments you have submitted to CHASM, and how many of your cases were sent for second-line assessment. You can also access information regarding your CPD points, and you can generate a report outlining your progress. This is available in the Reports tab. We also want to thank the CHASM team and Peter Zelis for their input and skill in production of this video. This final slide gives you information about how to contact the Clinical Excellence Commission and CHASM. Remember, we really do value and welcome your feedback. Thank you.